Homelessness has become a defining challenge for many American communities, a visible sign of distress that is often misunderstood. The conversation is frequently filled with emotion and assumption. To find real solutions, we must begin with clear, undeniable facts. The federal government have always set an ambitious goal of reducing and possibly ending homelessness. This target was laudable, signaling a commitment to confront the crisis. Unfortunately, the 2024 point-in-time count revealed 771,480 individuals without stable housing, a dramatic 18% increase from 653,104 in 2023, the largest single-year jump on record. It pushes the problem to its highest point since nationwide tracking began in 2007. This surge contradicts the reduction goal and shows the crisis is accelerating. To craft sensible and effective responses, we must examine the underlying drivers, especially housing supply and costs. The federal government categorizes homelessness into two main groups: sheltered and unsheltered. Sheltered individuals are in emergency shelters, transitional housing programs, or other temporary institutional settings. Unsheltered individuals live in places not meant for human habitation, on streets, in parks, in vehicles, or abandoned buildings. Many remain exposed to the elements, facing immense risks to health and safety. Shares vary dramatically. New York's robust shelter system contrasts sharply with West Coast unsheltered rates. Visibility drives public discourse and often pushes space management policies over housing solutions. The rise in unsheltered homelessness signals a system under severe strain. Vulnerability to violence, illness, and chronic stress intensifies outdoors. Chronic homelessness has reached a record high: 152,585 individuals, most unsheltered. This reflects a failure to supply intensive support and permanent housing. Outreach and shelter services matter, but the common solution is the same: both groups need a home. To address homelessness, we must understand who is most impacted. While it can affect anyone, certain groups are disproportionately vulnerable. Adults over 25 are a large share, and men are more likely than women to experience homelessness. African American and Native American communities are dramatically overrepresented. These disparities stem from centuries of systemic inequality and discriminatory housing policy. In 2024, Hispanic and Latino homelessness rose 32%, over 56,000 people, accounting for nearly half of the annual increase. HUD officials cite recent asylum seeker inflows straining already scarce shelter and housing systems. Family homelessness rose 39% nationally and more than doubled in 13 migration-affected communities. Veterans are the exception. Homelessness fell 8% to a record low due to sustained, targeted investments. HUD-VASH and supportive services show that coordinated, well-funded strategies deliver measurable results. Mental illness, substance use, or an unwillingness to work can increase vulnerability, but they do not explain geographic variation. If personal factors drove rates, high-poverty cities would always have more homelessness. They do not. Many high-poverty places have lower homelessness, while prosperous cities face severe crises. The culprit is the housing market. High costs and low vacancy rates squeeze renters, especially at the bottom. When demand outstrips supply, rents rise and displacement follows. A job loss, medical bill, or modest rent increase can trigger homelessness in tight markets. Research consistently finds strong links between higher rents and higher homelessness. Home prices are up 60% since 2019. The median single-family home hit $412,500, about 5 times median income, far above the 3x benchmark. Locked-out buyers stay renters longer, lifting rents and pushing the most vulnerable over the brink. The affordability crisis is the result of a structural housing deficit over more than a decade. After the 2008 global financial crisis, construction plummeted and never fully recovered. The U.S. shortage stood around 3.2 million homes in 2024. Building has picked up, but not fast enough to close the gap quickly. In healthy markets, higher prices spur more building and ease costs. In many metros, that link has weakened, or even reversed. Barriers include restrictive zoning, lengthy approvals, high land costs, and community opposition. Codes limiting density, prohibiting multifamily, and imposing large lots drive costs and reduce potential homes. When job growth meets fixed housing, prices rise and the lowest income residents are priced out. Naturally affordable stock is demolished, upgraded, or inflated away, leaving a severe shortage of affordable units. Recognizing homelessness as a housing problem clarifies the path. We need demand-side help to afford homes and supply-side action to add homes. Housing choice vouchers reduce homelessness, but only 1 in 4 eligible households receives one. Emergency rental assistance proved prevention works during shocks. Housing First moves people into permanent homes quickly, then offers voluntary services. It's more humane and cost-effective than managing homelessness through ERs, shelters, or jails. Supply solutions are indispensable. Reform zoning and streamline approvals. Allow more density, reduce parking minimums, and enable ADUs to lower costs over time. Tie funding to measurable progress, removing barriers to building. Building more homes is the foundation upon which all other solutions rest. The record-breaking rise in homelessness is a clear signal our systems are failing. The crisis stems from a mismatch between what people can afford and the cost of a home. Personal struggles raise risk, but tight, expensive markets push people over the brink. Correct diagnosis leads to the right cure. We need a sustained, two-pronged strategy: help people directly and fix broken housing markets. Scale evidence-based models like Housing First and permanent supportive housing. Ensure people with complex needs receive stable homes and wraparound services. Dramatically expand rental assistance to bridge the gap between incomes and rents and prevent shelter entry. The veteran success shows what happens when we target resources, coordinate efforts, and commit. Programs alone won't solve it. We must build more housing. Federal, state, and local governments must dismantle regulatory barriers that stifle construction. Reform outdated zoning codes. Allow more housing types. Create incentives for homes affordable to low and middle-income Americans. Not either or. We need an all-of-the-above approach to increase supply. Move beyond reactive measures like shelter expansions and encampment clearings that only manage symptoms. We need long-term vision and political will to change housing markets. The data is clear. The solutions are within reach. Expand proven supports and unleash the building of homes communities need.